Hello friends, this is a case of robotic cholecystectomy. This is just a simple gallstone surgery, and we can see here Da Vinci is used for cholecystectomy. So just we will start the dissection of the peritoneum, posterior peritoneum of the cystic pedicle, and here we are using one atraumatic grasper and one Da Vinci hook. So slowly the cystic pedicle posterior peritoneum is separated by giving the anteromedial traction, and then the same will be done for the anterior side. Care should be taken that we should avoid overhooking to touch the liver, and slowly the anterior peritoneum is also separated. After that we can use Maryland, but here we will avoid using Maryland, and entire dissection, even the blunt dissection we will do by the hook itself. So we have to hook, look and cook, and slowly the cystic pedicle peritoneum is separated. And now mechanically we will just make the anterior and posterior window. So we can see cystic duct is in front and cystic artery is behind, and just little bit hooking mechanically and going parallel to the tubular structure. This is the window between the artery and duct. And now this is the posterior, which is in between the artery and the inferior surface of the liver. Here we can see this is the CVD down and this is the cystic duct. So this was just a easy case, simple cholecystectomy, and duct is separated from the artery, and this is the anterior and this is the separation completed. So we have a sufficient length of the duct now to apply clip, and this is the artery, and there is a sufficient length of the artery also to have a safe application of the hemolock. So we are using hemolock applicator here, and we will apply hemolock, two hemolock on the duct and one over the artery. You can apply safely two towards the CVD and one towards the gallbladder, that is better. But here we will apply only two on the duct and one over the artery. And after that we will ask our assistant to cut it with the scissors. This is the laparoscopic scissors, and duct is cut first. However, you can cut the artery also before. Ideally artery should be cut before, and we can see the little one drop of the bile has leaked from the duct. That is good, and there is a good dumbbell formation. So only one hemolock is sufficient. After that we will cut the artery by the hook or scissors, but cutting by the hook is better because it will have some coagulation as well. And this is again the monopolar robotic hook is coming, and the artery is also separated above the hemolock. At least 3 to 5 millimeter artery should be left towards the hemolock. And now we will separate the gallbladder from the liver. So in this case we have not used the fundus grasper. The robotic grasper was used for giving anteromedial and the cordial traction, all will be done by the one grasper robotic only. So, now the gallbladder is separated and it will be removed by the claw forceps passing through the 8 mm port. So, thank you very much for watching this video. This was just a simple case of robotic cholecystectomy.